Hello, this is Dr. Ron Adams, and tonight we're going to be talking about our Thyroid Recovery program. If you're watching this video, again, more than likely you've already been diagnosed with some sort of thyroid condition, whether it's hypothyroidism or hyperthyroidism. You've probably been on medication. Chances are you've been on medication for years. You've been battling hair loss, fatigue, mental fog, inability to lose weight. Some folks that we see have just a myriad of symptoms. They'll have gut issues, insomnia. If this sounds like you found the right place. We take a different approach to the thyroid. As opposed to prescribing you Synthroid or levothyroxine, we are going to go and do some in-depth metabolic testing. We're going to do some neurologic testing. We're going to try to find out what is triggering your thyroid to cause the problems that you've had. Most of the patients that I deal with that have thyroid issues, the shortest amount of time I've seen is someone who's had it for 6 years. The longest is 26 years. They've all been through all the drugs. They've gone up with the levels. They've gone down with the levels. Your thyroid gland is located right here, just at the base of the neck. It's about 1.5 by about 1 inch in square. But the significance of the thyroid is it controls hormone regulation for pretty much every cell within the body. If that thyroid is being attacked by something, let's say an autoimmune condition, in other words, another part of our body is attacking it, or there's some condition within our body that's attacking it, it can wreak havoc on the system. In the brain, we have what's called the pituitary gland. The pituitary gland is basically what releases what's called TSH, thyroid stimulating hormone. That sends that hormone down to the thyroid. The thyroid produces things like T3 and T4. In normal blood work that we see that comes across, usually the patient brings it in, the only thing that it's tested for is typically TSH levels, maybe T3 and T4. We don't look at it, on the testing they don't look at any other antibodies that are necessary. So we're only looking at a very narrow picture. When we do our testing, our metabolic testing, we do what's called functional testing. We want to make sure that you are within the range that's a functional limit, or if you're outside of that, then we know basically where things are going. What we look for is different than what you've looked at before. In a clinical standpoint in our area, TSH levels, when they look at it at the lab, it goes from a low end of 0.45 up to the high end of 4.5. On the functional level, we look at it from 1.8 to 3.0. If it's anything above 3.0, that could indicate that you have hypothyroidism. If it's below 1.8, it's hyperthyroidism. Now there's another condition that we might touch on is what's called Hashimoto's. It's an autoimmune condition. Hashimoto's will attack that thyroid gland, and it will send things through the roof. So the reason that our program is a little bit different is we're not going to hand you a pill. We're not going to say, take this magical pill and everything is going to be all right. We're not going to sit down and tell you, you know what, we can't do anything about your thyroid, so we're just going to wait till it burns out and then we're going to cut it out. That is one of the options, surgical, that we don't do that. So this DVD is just a brief introduction. The second half of it is going to go in more in depth of what we do. In order to get the DVD, all you have to do is this block that's on the left-hand side of this screen. You're going to put your information in there. We're going to need to have your name, your phone number if you like, and an address so we can mail you the DVD. If you want to put your phone number on there, we just assume that you want us to contact you. We'll call you up. We can set you up for a consultation. Consultation is free. You and I sit down knee to knee and we discuss what's going on with you. And we find out if this is something that you'd like to pursue. If you are a reader, one book that I would highly recommend getting is this particular one right here. It's called Why Do I Still Have Thyroid Symptoms When All My Blood Work Is Still Normal? The author is Dr. Datis Karazian. He is one of the most foremost experts on thyroid conditions. He is also one of my professors. I've learned how to deal with thyroid from Dr. Karazian himself. So I would highly recommend the book. I highly recommend you call and get a copy of the DVD, and then we can sit down and we can discuss where you would like to be. I thank you for your time. My name is Dr. Ron Adams, and I look forward to hearing from you. Thank you.